Friday, the 19th day in the month of February 2026. And of course, this is the big question right here on Women Radio. The big question is a program where we get to discuss and provide solutions to issues affecting us as a nation. Right. So, let's pick on the big question. We had Ambassador Roma offered to be with us, but unfortunately, network glitches, and some other things that came up, so we couldn't really hear from her as regards to thyroid disorders because that's what we started, got on with last week. Now, what we're talking about, just in case probably you didn't join us for the previous conversation, is thyroid disorders in Nigeria, understanding the signs and protecting our health. Right? That is what we are looking at today. Thyroid disorders in Nigeria, understanding the signs, protecting our health. That's our topic for today. Now, we thyroid is, you can just give a little bit of context or background. Thyroid is a small gland, but it plays a very big role in our overall health, from metabolism to energy levels to mood, weight, and fertility. Now, unfortunately, many Nigerians live with thyroid conditions without even knowing it, which is often we to not mistake the symptoms for stress or just normal body changes. But today we want to raise awareness as regards to thyroid, as regards to the myth, as regards to also making sure that you have the appropriate knowledge and you're aware of what it entails when we talk about thyroid and some of the things you should watch out for. So yeah, Ambassador Roma today is one who is the organization who is creating awareness on this. All right. So yeah, we will be talking about this because she has experienced this, and I'm sure that she would have a lot to say as regards to thyroid and how it affects us. So for you to be a part of it, you can dial 070917917, or better still 09155917917. Feel free to go ahead and send us WhatsApp messages to 07031756537. All right, let's head on to meet Roma and get to hear from her. Good afternoon, Roma. How are you?
Good afternoon. Thank you for having me again. I believe we're going to do better today.
Definitely, definitely.
Yeah, yeah, yeah,
Yes.
yeah.
All right, great. So let's get to the conversation today. Can you talk about thyroid and how common it is in Nigeria and why we don't seem to?
I can't really get it very well. The line is echoing. I don't know why it's echoing. I can't really get it very well. And I think it's over there because here is very peaceful. So the network, can you come again with the question? I
All right.
can't.
What we are saying is um, brief description of what thyroid is and how common it is in the country.
Okay, the thyroid. Thank you so much for your introduction. My name is Amsadori Rama Opotibe, a thyroid disease survivor and the founder and president of Thyroid Awareness and Support Initiative, TASI in short form. So, the thyroid is a small butterfly-shaped gland located here on the neck, at the base of the neck. Even though it's very small, but it plays a very huge role in the body, which you mentioned earlier. The thyroid produces two hormones that control how our body uses energy. I'm going to state everything in a layman's language so that
Yeah.
the audience will really understand. Yes, it produces the hormones that control how the body uses energy. That is what we call metabolism. This affects things like our heart, our weight, body temperature, mood, fertility, and even how the entire body functions, the energy. Then that is to tell you that thyroid gland is a gland. It's connected to all parts of the body,
Hmm.
from our hair to the sole of our feet. It is regarded as the thermostat of the body. You know, when the thermostat is working very well, it will be putting um, every organ system of the body, the cells, in place to do the right jobs they're supposed to do. It controls it when it's supposed to be high and when it's supposed to be low, and bring it at par with what the body needs. So that is also to say that the whole body, the excretory system, the reproductive system, because it also affects fertility. The every system in the body is connected to the thyroid gland for it to function optimally. So when there's a problem in the body, that means the hormones are either producing too high or too low. When it produces too high, it is called hyperthyroidism, produces more than what the body needs to function at a particular time. Then it produces too low, it becomes hypothyroidism. And each of these um, issues have their own symptoms associated with them that will tell you that something is wrong with you, even when the person does not even know what is wrong. And that sets you on a journey to find out exactly, is this problem with from the thyroid gland. Yeah.
Hmm. All right. Thank you so much for giving us that brief description there as to that and how it when we practice it. So um just share with us a little bit of your experience, some of the symptoms, how you treated, how you look at it, and how you did it. Just a brief description of what you
Of
went.
the symptoms. Okay. Okay, like I mentioned, there are different types of issues that may occur on the thyroid gland. Okay. Some of the that, like, we have hyperthyroidism and hypothyroidism, which are more popular and more common now. So when someone is having hyperthyroidism, which means hyperactivity of the thyroid gland, the person may start having an unsolicited weight loss, rapid weight loss. Someone that is not going to the gym, someone that is not doing any measure to reduce weight, to see that person, the
Hmm.
person will be going down. Then you see it's a rapid heartbeat, that is palpitation. Unless you see the person, you can't even do anything, extreme weakness, heat intolerance. I'm speaking, like, if I should speak from my own experience, it started from infertility because I had 3 children and have rested for some years for me to now have another one that will be the baby of the house. So, and the 3 I had, I didn't even it was effortless. So the fourth one now became a problem. I didn't know that it has already started eating down in me. It wasn't diagnosed. Then you can start having anxiety. All of a sudden you start having anxiety, you become irritable. Any little thing or nothing that somebody does, you flare up and begin to pick quarrels anyhow. Then heat intolerance, you see where people are feeling cold, you are the only one that will be feeling hot.
Hmm.
You're the only one that will be feeling hot. At times, diarrhea comes. You didn't eat anything, you slept well, the next morning you start having diarrhea, or at any time, fatigue, extreme fatigue. Then it affects menstruation. I've said it before, female reproductive system. This menstruation may be irregular. It may not even come at all. The person will keep going for pregnancy tests, hence you are not pregnant. Then hair and skin thinning, even the nails, it will affect the nails.
Hmm.
Poor concentration. The person, as you're now presenting, you may want to say something, you forget about it. They know that something is wrong, and it's a hormonal issue. So, and the oga patapata of them all is the swelling on the neck,
Ne-
which is common. Yes, the swelling on the neck. You see people that have, that is called goiter, because people don't know the difference between thyroid disease and goiter. Goiter is a form of, can be a symptom of thyroid disease. It can also be a thyroid disease on its own, because some people are not hyper, they are not hypo, but they have goiter on their neck. Then when it comes to hypothyroidism, which is under production of thyroid hormones, it's just like opposite of hyperthyroidism. You see that person adding so much weight,
Hmm.
gaining weight. Yes. Also, fatigue. There are some symptoms they share in common. Inability to lose that weight, no matter the kind of measures you put in place to lose the weight. And once the person is not diagnosed and is not on treatment, the efforts you put to lose the weight becomes futile, because you need to be treated for every, or your body metabolism to, correspond with the whole body.
Yeah.
Then cold intolerance. You see that person, now the weather is too hot. You see that person always with sweater and jackets covering up. You can't even stay in the office. The person will become a nuisance, because every little cold contributes a lot to that person's discomfort. And people around that person will not even notice that. Then hair loss also. Person can be losing hair. Then brain fog. The person cannot concentrate. The person will be forgetting things. Will abuse her. You are too lazy. Then this lethargic feeling, you don't feel like doing anything. You can wake up in the morning and feel like sleeping and sleeping back. Then fluid retention, you see that person bloating most of the times, face puffiness, and sluggishness, muscles and joint pains. All those things are associated with hypothyroidism. Then there will be time where there is no hyper, where there is no hypo. The person can just have a goiter. And there is thyroid cancer also. There is thyroid cancer, which can make someone to start having, that lump on the neck. That is
Hmm.
one common symptom that all types of thyroid disease has. But there are people that also have thyroid dysfunction, but they don't have any swelling on their neck. That is the confusion.
Hmm.
So, and some of these things like thyroid cancer, some people may not even have a very well defined lump, but there is something going on. Then when the person starts feeling like having coarse voice, you see some people all of a sudden, maybe it's a presenter like this, very sweet voice, you see that person having the voice will change. And there may be swelling or little swelling.
Yeah.
Nobody hears. And sometimes the person coughs. This cough that keeps coming, consistent cough that after treating it, it will still come back. So all these things contribute to thyroid dysfunction, and there are different symptoms.
Hmm. All right. Thank you very much, Pastor Europe, for um, taking us, Iroma, for taking us through, some of the signs and symptoms of thyroid, the types of, thyroid that we have. All right, this is your Women Radio WFM 91.7, and it's about 21 minutes past 12 on this side of the radio, and this is Women Radio WFM 91.7. My name is Rose, and I have Ambassador Uroma Ofutube with us this afternoon on the program The Big Question, and we're looking at thyroid disorders in Nigeria, understanding the signs and symptoms, understanding the signs, protecting our health. All right, now that we've gotten to understand what thyroid is, now take us gradually through some of the symptoms, some of the treatments, of course, treatment options for thyroid and how we can prevent it. In our day-to-day activities, how do we try, or how do we prevent this from happening to us? How do we protect ourselves?
Okay, first of all, let me enlighten the public also that thyroid disease is genetically connected. It's a hereditary disease. Yes, it runs in the family. So if you know that your family has a history of any form of thyroid disease in the
Hmm.
past, in the present, make sure you check yourself. As in, you check yourself. Maybe you've suffered it and you survived it.
Hmm.
Once in a while, take your children to go and check their thyroid, because early detection is key. Then thyroid is you're talking about how to prevent it from coming. So thyroid is a very sensitive and sweet gland. It needs a lot of everybody. I'm talking to everyone now. You see, if you want to prevent it from coming, is a diet dependent gland
Mm.
that holds the entire body. You have to monitor the kind of things you eat. You see, all these processed food, all these, especially people that are already predisposed
Yeah.
to, it is an endocrine disease. Let me also mention that is rated the second most common endocrine disease after diabetes. So automatically when somebody is having any endocrine ailment, you already know that you are predisposed to having thyroid disease. Yes, and begin to monitor what enters your mouth. You see all these processed foods, all these soda drinks,
Mm.
artificial sugar, processed carbohydrate, because at times there is this autoimmune thyroid disease, Graves' disease, when the immune system starts attacking the thyroid gland. So it begins to cause the body to have some intolerances. So you have to monitor.
Mm. Mm.
That is, your diet has to be organic. Organic. Avoid smoking, drink alcohol intake, and all those things can cause the thyroid to start having issues. If it runs in your family, always go for at least every 6 months or 1 year. You take your family, your children to the clinic, to the lab to check for
Yes.
to do a thyroid function test.
Hmm.
Yeah.
All right. Thank you very much, Irube, for this. Now, why is it necessary that we create awareness on this small gland, that brings, could bring a lot of pain to the individual if not maybe checked or if not taken care of, or if we don't take extra effort to make sure that our health or whatever we eat is good to go. Tell us why we need to keep talking about thyroid and creating awareness on this.
Thank you very much. I want to appreciate my own organization, TASI, for the work they've done so far. The awareness goes to the general public. The awareness goes to the medical professionals. It also goes to people, family members, and spouses of people that are suffering from this thyroid disease. Number one, um, I use myself as an example and as a survivor.
Yeah.
You see, knowledge is very important, very, very important, because many people's journey have been prolonged because of, number one, misdiagnosis. The reason is that some of these symptoms I mentioned mimic other popular health conditions. So most of the times, like in my own case, it was difficult to diagnose because doctors kept giving me medication for high blood pressure, and I had never been hypertensive in my life.
Oh.
But this thyroid disease induced hypertension. So as I was taking the medication, it wasn't giving me, I wasn't improving in any way. So since this thyroid gland is connected to the entire body and supports the body system to function optimally, the reason why the awareness has to go on is considering this function that it plays in the body. Anytime somebody comes up with, persistent complaints, tell that person to go for a thyroid function test. Don't send patients to go and do thyroid and malaria. Typhoid and malaria.
Yeah.
That is the general thing. So even the doctors, when they don't cite any swelling on the neck or eye bulging, because hyperthyroidism bulges the eyes and begin to tell you that something is wrong with you. So aside all these clinical symptoms, it can start from the inside and begin to disturb that. So all these symptoms I mentioned, most of them mimic normal medical conditions we see every day. You can see someone that is always weak and tired. Say, you are always weak, go and do malaria test. Maybe it's malaria. So,
Hmm.
but when we keep amplifying our voices And I want to appreciate Women FM also for joining us to amplify our voices, because I believe that many people are hearing this today and they will do the needful. So it's often misdiagnosed. Let me put it at that. So that when a patient, especially a woman, comes and complains, heart, my heart is racing, stop sending that person to the cardiologist. Tell the person first how my own was diagnosed. I didn't have any lump on my neck. I didn't have anything, but my eyes were bulging to the level of touching my glasses.
Hmm.
So my diagnosis came through an eye hospital, because I had to visit my eye doctor, and she's such an experienced woman that she didn't even look at my eyes. She didn't examine my eyes. She just told me, go and do a thyroid function test, because the sign was already there. That was what took, that was where my journey started. So we keep talking about it, keep louding the symptoms so that people will know and not associate it with other diseases. It's even better that when you have some symptoms in your body, especially a woman, and most times you see some doctors or medical personnel come up to do some awareness on fertility and infertility. They don't mention thyroid disease. And I want to say it here. I personally experienced it in a very hard way.
Hmm.
We should talk about how thyroid impacts fertility. A lot of women have been labeled infertile and barren. Some will send them to go and do hormonal profile. They will not add thyroid function.
Thyroid function.
Yes. So in TASI, my organization, it
Hmm.
has happened to a couple of women after treating them, especially hyperthyroidism. After the treatment, they will take in and have their children,
Hmm.
even at any age. Yes. So doctors should also, especially gynecologists, when they come, I thank God the awareness is really changing narratives.
Yeah.
So many people call in to tell us it's changing narrative, because people already know when they wait for 1 year, 2 years, 3 years, they have to go for a thyroid function test to rule out any thyroid dysfunction
Hmm.
that may affect their fertility at a particular time. So it's often misdiagnosed.
Yeah.
Let people go for a thyroid function test when they're experienced. Don't let all these symptoms come on you. Once you experience it, or even women should go and be testing themselves, especially when you want to get married. It should be among the staple, among the primary test diagnosis that the person has to. Yeah.
All right, thank you very much. So just as we wrap up the conversation this afternoon, what would you want the listener who has tuned in to listen to this to take home? What's that final word you would want to tell the listener this afternoon?
And the final word, there's something I didn't mention, that thyroid disease is found more prevalent in women to a very large extent, which has not been proven medically or scientifically. This is why it happens like that. So, for every woman out there and for everybody out there,
Hmm.
make sure you check yourself. Always also check your neck, because some people will come to me and say, this thing, I noticed it last month, last 2 months, but it can't be last month because you are not checking yourself.
Yeah.
Just like they say, check your breast. Is not, but some people, when you tell them, they will say it's not my portion.
Hmm.
Early detection, you should shun this mentality of it's not my portion,
Yeah.
because early detection saves a lot.
Yeah.
Always check yourself. As a woman,
Hmm.
check your thyroid function test. It should be your priority every year, because every woman, and at the same time, when you are up to that menopausal stage, you start having all these symptoms. Don't allow your doctor to attribute it to only menopausal signs. Go and do your thyroid function test to ensure that, to rule it out and ensure that what the doctor is telling you is true. Time has come when everybody has to learn. When you get to your doctor, you talk with your doctor, not the doctor talking to you. Discuss your issues and contribute your own. Thank God for technology. You can browse so many things and research and get more knowledge.
Hmm.
Yeah.
Okay. So at the end of the day, um whatever kind of symptom you have, it's best you check it out. And for a gland as small as that, it could be often overlooked to the
Yeah,
extent that nobody takes note of it. So it's good that we have organization like yours, and of course with media partners like us to drive this home, to make people understand that there's a tiny gland there that looks like a butterfly, and that's the very important gland that you need to always have a look at or check, because at the end of the day it might just be disrupting your body system, your whole body system, without even you knowing anything about it. All right, so this is where we will wrap it up for today. Thank you so much for coming on the program and talking to us about thyroid, and making us more aware that there's something like this in us, and this could cause a lot of harm to us if we don't take care of it. So basically, what you're saying now is that to prevent any issues or disease coming from that has to do with the thyroid, we have to take note of, or we have to be careful with what we ingest. That's
yeah,
what you're saying now, in order to prevent it, right?
yeah.
Okay,
And
great.
also rich, eat food that are rich. There are
Mm,
some people that are having all these goiters because of lack of iodine. Some
mm,
people have more iodine. So that is the reason why people should be testing themselves. You just don't have to live life like
mm,
that.
mm.
Yes.
All right. Thank you so much, Ma, for coming on the program today. We do appreciate you, and all the best
Thank
as
you,
that
Women
one.
FM. Thank you so much. I am so excited. Anytime this is a subject that even if you call me, no matter how engaged I am, because I know that my coming here is for one person, even if it's only for one person
Mm,
that to be saved. Yes. So it's something that is my pleasure anytime I'm called upon to talk about it, because I survived this disease with a
mm,
near-death experience. And I
mm.
don't want anybody to stand alone. I am there for you. I can drop my contact. Nobody that is suffering from thyroid disease should stand alone. I
Yeah.
am here for you. Tassie is there for you as
Okay.
as a safe nest
All
for
right.
anybody to come in and then get some resource materials and also get some counseling concerning it, and how you can manage it and come out of it. Thank you
Thank
so much. I really appreciate you people. And I
you. Yeah.
believe we can do more of this. We can do more of this, even as Women's Month is approaching. We can
Mhm.
also, yeah, we can also do it to
Okay.
get more people.
All right. Then thank you very much. Do want to have a great day and enjoy the rest of the week.
Welcome. And
All
you
right.
too.
Thank you. All right, so that's it on the big question today. Do you want to stay with us right here on Women Radio WFM 91.7? A very big thank you to the producer of the program, Fee Akinremi, and of course, our executive producer, Tom Okiwale. My name is Rose Yusuf Kai, so do you want to stay locked to Women Radio WFM 91.7? Coming up at 1 is Lunch Vibes. All right, so happy Love Week, and don't forget that on Friday, Fee will also be here to give you another round of love for the Valentine's Week special. Okay. Yes, stay with us right here on Women Radio